Firstly, I welcome Dr. Rizwana B. Shaikh ma'am, who's our speaker for today. I thank her for accepting our invitation in such a short notice. Introducing her is an honor to me. Dr. Rizwana ma'am has worked for over 25 years in community medicine and public health in India and abroad. She obtained her MBBS degree from KIMS Bangalore in 1992 and MD in community medicine from JGMM Medical College, Davangere in 1998. And she obtained graduate diploma in health professions education from Gulf Medical University, UAE in 2010. She was Associate Dean of Assessments and Evaluation and Coordinator of Master of Public Health Program at Gulf Medical University, UAE. She is currently one of the academic advisors of the joint MPH program of University of Arizona and Gulf Medical University. She has several research grants, including from WHO and New York University. She has more than 35 published papers in national and international journals. She is currently working in JGMM Medical College, Hubballi, as an associate professor of community medicine. And on a personal note, I've known ma'am for 5 years now. She has mentored us in various projects, including ICMR STS. Now, without further delay, I now hand over to Dr. Rizwana ma'am. Over to you, ma'am.
Thanks a lot, Sanat, for that nice introduction. I would like to thank IFMS and GAIMS, that is Global Association of Indian Medical Students, Karnataka chapter, for inviting me over. A personal thanks to Dr. Sanat and Ms. Waman from JGMM for reaching out to me and confirming this presentation. And I would also like to thank Dr. Aslam Mohammed, State President of GIMS, and Mr. Sairath Datta, National President of IFMS. So without much ado, let's get down to business. Today's session is all about the ICMR project. So let's discuss that in detail. We can also have a question answer session in the end. But right now, ICMR projects are a good opportunity for students to, the guys too. Actually, the senior students are exempted from this. I'm sorry, my slides are not moving. Yeah. Now, if you see the new changes in STS 2024, the eligibility has changed. So students from first and second professional years studying in NMC or DCI recognized medical and dental colleges in India, and before they appear in their fourth professional year exams, are eligible to apply. So you can see first professional year students carry out work from first to third year, and second professional year students carry out work from second to fourth year. And now there's a new thing that students holding OCI cards or NRI cards, they can all apply, and this card must be submitted. Now, who is not allowed to submit their projects is third year students, fourth year students, and interns are not eligible to apply. And what is the tenure of the work? So the students will, earlier we had 3 months. The students had 3 months to collect data, but now it's divided into 3 parts of 2 months each for 3 consecutive years. So totally the tenure is of 6 months. So if you see, students can, conceptualize, develop, and submit their research concept note in the first summer break. That is between first and second professional year. And data collection will be done in the second semester summer break. That is between second and third professional year. And data analysis, preparation, and submission of the report, manuscript, all that is done in the third summer break, that is in between third and fourth professional year. So the tenure is also extended. And then you can see that the financial support is also increased. So now you have 60,000 that is given to the student for 6 months of research work, and the student will be given a certificate, and the guide's name will also be there in the certificate. A separate certificate is not given to the guides. So what the student gets is the only certificate you get, but the guide's name will be written on that. And the stipend will also be given in 3 installments, not like earlier after you complete the project, but now the first installment, once your concept note is selected, you will get 15,000. Okay, that is after your concept note is submitted and accepted. Now the second installment is at the end of second year. After you collect data, you have to submit an interim report about the data collected. Then you will get another 15,000. And the third and final installment is at the end of third year's work, and upon submission of the final report. That is, the ICMR will review your final report and see the analysis, how you have analyzed, how you have prepared, and whether the submission included everything in it. And then your final installment is given, that is an installment of 30,000. Now, if you look at the guide eligibility, only full-time faculty members working in the same medical or dental college as a student, where the student is enrolled, can be the guide. So you do not have part-time consultants or visiting faculty or residents, tutors. So these people cannot be guides. And the total number of projects that will be awarded STS fellowship is about 2,000. That is 2% of the total medical dental students, of which 80% will be given to MBBS students and 20% to BDS students. But there's a relief here where they say that the actual number will be determined according to the applications received and the availability of budget. So they also have specified very particularly that you are not going to give away any of your identification details, like the name of the student or the name of the guide, any contact details like your phone numbers, email addresses. Nothing should be there. It should not be provided in the concept note. So your concept note is nothing but your proposal. Once you register, you will have they will give you a reference ID, and for all further communication, this reference ID is the only thing that will be used. And they have specified at 2 places in the document that if you divulge your
Guys, kindly mute yourselves. Padmanabhan.
Okay. So personal information. Can you, Dr. Sanat, can you ask everybody to mute?
Everybody, kindly mute yourself. Thank you.
Okay. So if you put your personal information out there, your project will be rejected. They have also mentioned the type of study that you can do. So you can do clinical investigations. So clinical investigations is when you actually talk to the patients. Any study, like you want to study the fetal outcomes in a mother with the PIH, is a clinical investigation. Epidemiological investigations is like when you go into the field and you want to study, say, the prevalence of childhood tuberculosis in Dharwad district. So that becomes an epidemiological investigation. Field operational research. Now, field operational research is when you have an ongoing national program and you want to better some things there. So you can do that with your operational research. So now we know that in the NTEP program, you have TB preventive therapy. So how you can make sure that people are taking it, there's compliance to medications here. So either by telephone use and sending them SMSs or informing them or going to their houses. So if that kind of a thing, you want to improve a national program, already ongoing program, and you're contributing to it, that becomes field operational research. So health education research has been added. So health education research is like anything to do with health education. The curriculum has changed. Now we have the CBME curriculum. So suppose you want to study self-directed learning among medical students, has it increased after you have started the CBME curriculum? That becomes a health education research. Laboratory investigations, any research that involves laboratory investigations will be like, suppose you want to know the utility of hematological parameters in diagnosis of sepsis. So that becomes a laboratory investigation, and that is considered as a laboratory investigation research. There may be students who come up with very innovative product development. Product development is like, recently a student developed airbed uh, to carry people in remote areas rather than carrying the stretcher, an airbed which can be folded, and the student patents that. So that becomes a product development research. Then you have therapy and management, where you have one drug works better than the other, or one kind of management works better than the other. So this kind of research. So basically you have clinical investigations, epidemiological investigations, field operational research, health education, laboratory investigation, product development, therapy and management, and any other research. Any other research in the sense, suppose you want to do on healthcare financing, then you can specify that. Or if you want to do a research on AI in healthcare, so you can add that too. So any new thing that you added, there is also a scope to add others. Now, the format for STS research concept note is specified very clearly in the DHR document. So here you can see that the title has to have, you have to only use your STS reference ID. So once you register, you get that ID, you have to only use that ID. And title has to have only 25 words, introduction 300 words, objective 100 words, methodology 800 words, implications and outcomes. End result is 100 plus 50 words, and references in the Vancouver system, that is 300 words. Now, make sure that you stick to these guidelines, because if you try to, increase your words, or, it can get rejected at the initial stage itself. So this kind of thing, it may not be looked at by a researcher, or the person who is going through or the subject expert in research may not be looking at these things. These things can be looked at by any clerk. So don't get your project rejected because of the increased number of words. They will be just checking your title, whether it has 25, introduction, did you adhere to the word limit. It can be a little less than that, but never have more than that. They also have stipulated you can increase at the most 100 extra words, but try not to do that. Let's limit ourselves to these words that they have specified or stipulated, so that it does not get rejected by a clerical staff at ICMR, because they are the ones who are going to look at this, the word count and everything. Now, when Vaman and Sanat reached out to me, they specified some particular things. They said, like, how do you reach a research question? From where do you get this? Like, we are first year and second year medical students. From where do we get the research question? Or how do we choose a guide? So these were the kind of questions they were asking. How do we go about research? So I have tried to keep it as simple as possible, and as understandable, or as easy as possible for a first year medical student or a second year medical student to understand, because these are the people who are going to write up the STS this year. So how do you get, or how do you look for research questions? So there are different sources for a research question. That is, first thing is findings and problems that have been observed in prior studies or in others' work. Like, say you saw in a study done in Mexico, in Latin America, suppose they mentioned in their study that the form of smoking that is increased now is vaping or electronic cigarette use. So that will get you thinking, is this phenomena happening in India too? So I would like to study the number of university students who are vaping these days. Okay, so maybe from a prior study, you will look at what were their findings and what were their problems, and then you try to do that research here. Then mastering the published literature. Go through published literature extensively. Go to your library and you have all those journals out there in different subjects. So you go through those journals and see what can be done in India. Maybe the study was done in US, maybe the study was done in China or elsewhere. Uh, how can that study be done here? Is there a gap in knowledge in India regarding that particular area? So you can, so just go out there, go through published literature and the journals and see what kind of research is being done. The third is be alert to new ideas. Go to conferences, go to scientific meetings. In every conference, you will see that you have tea breaks, you have lunch breaks. Take this opportunity to go and meet senior researchers. Try to put forth your findings. They may tell you some good ideas there. Or if you have an idea, they may actually, suppose you have, an intention to do research in, say, urology. Go to a urology conference and go to talk to the surgeons out there. And they may give you some ideas that an undergraduate can do. So that is one thing. And then have a skeptical attitude about prevailing beliefs. And this can stimulate a very good research question. Be very skeptical about, is aspirin really required? Are statins really required? Be skeptical about anything and see and go and look at the literature out there. See whether this is really required. So be very skeptical about what the prevailing beliefs are. Like I can give you an example of peptic ulcer disease. While we were studying peptic ulcer disease, we didn't know that H. pylori causes it. This was way back in the 90s. We didn't know that there was something called H. pylori. It was only when a researcher thought that maybe it could have an infective origin. So he went ahead and tested on himself. And then we came to know that H. pylori, it's peptic ulcer disease is you have an etiological agent in a microbe there. Then application of new technologies, new methods of investigations, new markers often generates new insights and questions. So keep your eyes open and keep your ears wide open and listen to what's going on. Keep reading and see what are the new technologies out there. Like I recently went to a workshop in Bangalore where they had a technology where you don't have to prick a person to know the hemoglobin content. So you have this AI generated machine where the person has to put the finger on, like how you do your biometry. The finger is placed on a device and the device, they have ways of doing that and the device detects that the person is anemic or not. This is a new technology. Why should we prick a patient? So you can take up a study to see whether this device really works or not. So you can have some patients, say you have 100 patients, you give 50 patients the new way of testing and 50 patients the old way of testing. That is, you prick the patient and then you do the hemoglobin estimation and see which technology works better. So there are different ways. Any new technology, be very open to it and see how you can do a research there. Taking a new concept of finding from one field and applying it to another field. So any new concept that you have, say you have nicotine patches and gums, right? Nicotine patch is where you apply nicotine patch on the skin and, absorption is there from there. So can this new concept, like say a patient who has had surgery, can still not take medications. Can you have a patch for a painkiller? So from one field, you apply to another field and just keep your imagination roaming. Just careful observation itself can lead to many new research questions in you, and have that tenacity. Tenacity is you don't give up. You just say that I want to do this and how I can make it happen. Okay. And then finally, you can choose a good guide or a good mentor. They asked me to actually address upon that, how to choose a good guide or a good mentor. So you just go, you have so many faculties, you have different subjects, you have the first year subjects, the second year subjects, then you have the clinical subjects. Just look for your guide there, see what is your area of interest. Suppose your area of interest is to work on tobacco, then look for a person in your own medical college who has a tobacco research, so you can go ahead and do the research there. Or see what is your area of interest. A person may be very interested in pathology. So in that case, you look for a guide from the pathology department who can give you a good idea. You have faculty who are doing research all the time, and they have some very good ideas with them. And so you can go and contact them and make them your guide or mentor and do research under them. So this is how you go ahead looking for a research question. So I've taken a very, very simple example here so that our first year and second year medical students can relate to it. So what you have to do first is you convert a query into a researchable question. Okay. So how do you convert a query into a researchable question? For example, a lot of students now use energy drinks. Especially during exams, the frequency of use of energy drinks increases. So what are these energy drinks? What is it that they have that gives energy to people? Has its use increased among the youth? Is it documented anywhere? Is it published anywhere that youth are consuming more of this? And what are the consequences on health when a young person is drinking, guzzling down so much of energy drink? It has a whole lot of caffeine, it has taurine. What is happening to a person's health with this? So this is your query. What are these drinks, and are the youth drinking, and what are the consequences on health? So you could study energy drink use and its health effects among university students in Dharwad district or Karnataka. Now, once you decided on your topic, you brainstorm the problem. You brainstorm it and see what are all the aspects you want to study in this. So energy drink use, first of all, what are they? So you want to read the can and see what is in it. How many students are using it? Why do they use it? How frequently do they use it? Is there any gender variation in this? What are the health effects? Are they aware about the health effects? What are the health effects they are facing? Is it more among the high risk group? Like, are smokers using it more? Like other risk behaviors, like are alcoholics using it more? So you try to brainstorm. Once you brainstorm, you get a clarity about your topic. You get a clarity as to, framing your objectives. This becomes very helpful while you're framing your objective. We'll come to that because again, I was asked to address how to make objectives. So this brainstorming gives you a clear idea as to what do you want to study. So instead of energy drink use in the middle, suppose we take up vaping or e-cigarette use. So who's using it? How frequently are they using it? Is the salivary cotinine level more among the vapors than the cigarette smokers? Is the carbon monoxide level more among vapors compared to cigarette users? So whichever study you want to put in the middle, you brainstorm it and you have a clarity as to what you want to study. Another colleague of mine studied recently on different, novel fungi in COVID patients. So suppose you put this novel fungi in COVID patients in the middle, and then you brainstorm it. Are these fungi more among the diabetic patients? Are these fungi more among the older adults? Are these fungi more common in the immunocompromised? Or is it more in patients with tuberculosis? So you want to study different aspects of it. So you put it in the center and then you try to brainstorm what are the different things I want to study here. So for a good research question, it should be a finer research question. So what is a finer research question? So each one, F is for feasibility, I, whether it's interesting, N, whether it's novel, E is whether it's ethical, and R whether it's relevant. Now, for undergraduate research, we give a lot of importance to feasibility. Feasibility is whether you can do it, whether you can get the participants easily, whether you can get the resources easily. Do you get the expertise easily there? Only then you take up the research. So the most important aspect is feasibility. That is, you may plan a very grand research saying that I want to study so and so topic in all Indian youngsters. So it's not possible. So it's not feasible for you to do that. So it will get rejected. Make sure that whatever you have proposed for your study is a feasible study. You can do it within your time limitations, within your geographical limitations. You should be able to do it. You should have the resources to do it. It should be interesting for the researcher and for the readers. It should have some new knowledge. Suppose, like I said, vaping is more common in Latin America, but is it seen in India too? So that's a new information that you give. If you study it here, you are providing this new information. So that is the novelty of it. Even if a study has been done elsewhere, if you do that and you find and you have these findings in your own geographical area, it becomes a novel study. Is it ethical? Does it adhere to all the important ethical principles like patient autonomy or beneficence, non-maleficence, all these, whether the ethical confidentiality, autonomy, all these aspects, is it ethical? The study is ethical, you look at it. And then finally, it should be relevant. That is, it advances scientific knowledge, improves treatment, or influences policy. So a question should always be a finer research question that is feasible, interesting, novel, ethical, and relevant. Review of literature is the most important thing. So once you decide on a topic, you have to do extensive review of literature. Otherwise, you will end up writing your entire protocol. You will write your methodology. You will spend a whole lot of time writing the introduction, the rationale, the objectives, and you do a lot of brainstorming, all of that. And finally, you see that this research has been done by 100 other researchers. So then you feel really bad. I've spent so much of time on this, and this work has been done by so many other researchers. So it prevents duplicating work. So it's very important to review your literature. It helps to find out what the others have learned and reported, and what they have studied. It may help you in refining your statement of the health problem, and it helps you to familiarize with various research approaches that might be used in your study. So suppose what kind of questionnaires did they use? What kind of tests did they use? So it really gives you a good insight about that. And also it should provide convincing arguments for why the particular research project is needed. Your review of literature helps you in the justification of your study also. Suppose you have a gap in knowledge in one particular area, so that becomes a justification for your study. There's a gap in knowledge in this, and that's why I have to do this study. So review of literature is done throughout. First, you do review of literature before you even choose your topic. You do your review to see what I can study. After you have chosen the topic, again, you do review of literature to see how I can implement the study. Have other researchers done it? Is it done and dusted? And people no longer require any information on this topic. So you get a clear idea about that. And then you do your review of literature after implementation of the study. That is after implementation, that is after you have finished collecting your data. And now you're sitting to analyze your data and writing up your report. Again, you need a lot of review of literature. That is, you have to compare your findings with what other researchers found. So all along, your review of literature is very important. And where do you review this literature from? From textbooks, from published journals, from the internet. You have scientific websites like ProQuest, Medline, PubMed, Medscape, Oxford Journals, and so many others. If you can see the guidelines by ICMR, they prefer that you use references from PubMed index journals. There's a rider there that they prefer PubMed index journals. So try to look for PubMed index journals and refer them. You can also get review of literature you can do from national and hospital reports. Then you have studies in the departmental library. So you go to any department in your college or university, you will see that a whole lot of PGs have done so many studies. So you get a whole lot of literature there also. So this is how a Boolean search is done. So you can see here that if you use the word and, suppose you want to do a search for nursing and India. So you will see that nursing and India, it's only these set of people who are nursing and India. So it narrows down your search. If you use the letter, if you use the word or, nursing or doctors, you can see that your it becomes very general and you get a whole lot of articles in nursing or doctors. Or you can also ask as health staff, but not nurse. So again, you have health staff here, and who is not a nurse, you again have a small number of people. So you can limit your search very specifically. This is known as Boolean search. So if you're searching on Medline, it's better to do a Boolean search where you can limit your search by adding the phrase the and or not. Now coming to formulation of research objectives. By this time, I assume that most of you have are somewhere in your research project. That is, either you have finished writing up your research project. Some smart ones may have already submitted it. There are some people maybe who are still in the methodology, and some of you may be, starting the last minute. So just know how to formulate your research objective. If you have not submitted as yet, make sure that your research objectives are written very clearly, because your objectives are the heart of the study. So based on your objectives, you are going to decide what kind of a study design you're going to opt. Based on your objectives, you will make your questionnaire. Based on your objectives, you will make your result. And also because you're going to make measurable objectives. And based on that, you are going to write your conclusions, discussions, and conclusions. So formulating research objectives is a very important aspect of your research, or I can say the most important aspect. So objectives clearly tell you what is to be achieved by the study, and objectives should be closely related to the statement of the problem. So let me give you an example. What does an objective comprise of? Objective has three parts to it. It has a subject, it has an action verb, and it has a complement. Okay, subject is something that is being discussed. Action verb, mental or physical action, and complement is more information about the subject. So you can see here, this is an objective to compare the outcome of surgery 1 and surgery 2. So the subject is surgery 1 and surgery 2. The complement is the outcome, and to compare is the verb. So verb is most important because this is the measurable thing. To compare, you can measure, right? So here in the second objective, to estimate the prevalence of hypertension. So the subject is hypertension, the complement is prevalence, and the verb is to estimate. So remember that action verb is very important. To compare, to estimate, to outline, to to assess. So your action verbs are very important. So let us just have a look at what are general objectives and what are specific objectives. Your general objective of the study states what researchers expect to achieve by the study in general terms. So the specific objectives you can see is a breakdown of the general objective into smaller, logically connected parts. It should systematically address the various aspects of problem as defined under statement of the problem. Should specify what you will do in your study, where and for what purpose. Now, an important thing is young investigators are advised to resist the temptation to put too many objectives. There is a tendency to put too many objectives. Don't be over ambitious with your objectives. make few objectives that are achievable. So here I have an example of the same example that you had done the brainstorming to explore the energy drink consumption pattern and its effects on health among university students in Karnataka. So this is my general objective. I will break it down into specific objectives. The first specific objective is to estimate the proportion of energy drink consumers among university students. So that is my first objective. You can see that I have used my verb. Okay, to estimate is the action verb that I have used here. Then the next objective is to assess the frequency and quantity of energy drink use by the university students. Third objective is to assess the health effects of energy drink use with the dose consumed and to assess the awareness of effects of caffeine on health. In any research, you have to note the first objective usually focuses on quantifying the problem. So it is quantifying as to what is the proportion of energy drink users among university students. Is it clear now? You have a general objective and you break it down into specific objectives. And while making objectives, your action verbs are very important: to estimate, to assess, to explore. So these are your action verbs. Then the title of the study. Once you have a clear idea about what you are studying, you have your research problem, you have converted into a researchable question, and then you brainstormed on that, and then you know exactly what you're working about, and then you have made your objectives. After you make your objectives, then you can sit and write the title of your study. So the title, in fact, I would recommend that the title of the study can come after you have chosen the study design. You can make the title of the study. So a good title, this is what ICMR says, that a good, one second, okay. A good title should be short, accurate, and concise. It should make the central objectives and variables of study clear to the reviewer. These are the words of ICMR that I have directly taken. They want the research title to be like this. You just can't have a title like energy drink use in Karnataka. You must specify energy drink consumption patterns and its health effects among university students, among whom, where, what, all this is covered in your title. Sometimes you may also just consider adding fancier titles like energy drinks, a public health menace in Karnataka. So that the reader, it's a catchy title, so a reader may be more interested in reading your article when he sees this fancy title. This is something that you have to keep in mind when the project is evaluated. The results, the conclusions will be related to the objectives. So if the objectives are not spelled out clearly, the project cannot be evaluated. So you know the importance of objectives now. So you should make very clear objectives. It should be measurable. To make it measurable, you have to use the action word. So in your action words, you cannot use things like words like to understand the energy drink use. To understand is not a measurable term. To estimate is a measurable term. So you cannot use words like understand or to study energy drink use. To study is not measurable. So to estimate is measurable again. So when you use objectives, you have to, when you make objectives, make sure that you use the right verbs which are measurable. Now, this is what the format that STS format says about introduction. I have used the same words as ICMR. I have not changed anything here. So you can see that in the introduction, what do they want to see? They want to see the purpose of the study, the rationale behind the work, so that the reviewer may understand and appreciate the objectives, describe the importance or significance of the study, defend the model if you are providing one, and describe the reasoning that led you to select this topic. Briefly describe the experimental design if you're doing an experimental design and how it is accomplished. Describe the situation and specify clearly the gaps in existing knowledge and or controversy and inconclusive. So your introduction should show that the study is important. Why is it important? Are there any gaps in knowledge? And what gaps in knowledge are you going to fill up with your study? And again, this I have taken straight from ICMR, that what they expect from your objectives. The objectives should specify what kind of knowledge the study is expected to obtain. It should give a clear notion of what is to be described, determined, identified, compared, or confirmed. Okay, so the hypothesis may be stated and objectives should be very specific, to the point, and they should be achievable. They should be measurable, so they become achievable. This is the format for STS research concept note, again taken from ICMR as it is. I had already discussed the words with you, the number of words with you, the title 25, introduction 300, and objectives. Now we have also covered to an extent what the title should look like, what should be in the introduction, and what should be in the objectives, right? So we have discussed these three areas already. Now methodology again is the heart and core of your research. So in methodology, we'll go step by step what ICMR expects from you and what you're supposed to write there. So these are the 10 things that ICMR has asked in the methodology. They want you to specify the type of study and study design. They want you to talk about the study population, the sample size and selection criteria, selection of your subjects. What is your proposed intervention, if any? And data collection procedures and instruments used. What is the quality control that you have? How do you ensure confidentiality of data? How do you plan your analysis and statistical tools? What are the ethical considerations with all requirements? Again, they specify that do not name your data collection site, which can give away from which college you are. You only have to write which district, but not specify the data collection site as such. So let us go one by one. Type of study or study design, what do you have to write there? So there are different study designs. In first year and second year, you wouldn't have completed that. By third year, you will know what are the study designs if you have finished the chapter of epidemiology and community medicine. For you to just understand, the study designs can be interventional studies when you are intervening. As a researcher, you are intervening. Suppose you give drug A to a group of people, drug B to a group of people. That is your intervention. And then you study which drug acts better. Or you may give intervention as a health education to another group of people. And then you try to see who has better knowledge. So that is intervention. That is an interventional study. And the other kind of study is your observational study, where you just observe. It can be descriptive or it can be analytical. Descriptive studies are your case report, where you talk in detail, in depth about one case, or case series where suppose you have a new set of infections, like a group of people who have similar symptoms. So there you can do case series, and at one point of time you want to see what is the health situation of a whole ecology, something like increased, and the cases of asthma increased in the emergency in Dharwad district. So these are ecological studies. These are broad, assumptions that you make. The pollution levels increase and the hospitalizations due to asthma increase. So those kind of general conclusions that you make. These are ecological studies. So remember that in descriptive studies, you can only reach a hypothesis. Suppose you are studying smoking causes lung cancer. That is your research question: does smoking cause lung cancer? In descriptive studies, you will only reach a hypothesis. You can confirm that hypothesis with your analytical studies. Analytical studies are case control and cohort studies. In case control studies, you start with the case. You start with cases of lung cancer and you find out about the history of smoking. And then you draw conclusions. That is, you have cases of lung cancer and non-cases. So both these people, the cases as well as the non-cases, you will ask them about the history of smoking. And you find out that smoking was more among the patients with the lung cancer or those normal controls. Cohort studies are you start with the exposure. Like the same example, smoking causes lung cancer. You start with the exposure. That is, you take a group of smokers, a cohort of smokers, and follow them up over a period of time and see how many of them develop lung cancer and how many of them did not develop lung cancer. Not just the cohort, not just has the smokers, you will also have a control group, that is the non-smokers. Smokers and non-smokers, you follow them up over a period of time and see how many of them develop lung cancer. So these are the different study designs. Since in first year and second year, you may not have a very clear idea about this, you go to your guide and try to understand what all these studies are. Now, this is a different way of classifying, or a more detailed classification of study designs. Oftentimes we see that basic scientists are not able to fit their research into this general type of study designs. With basic scientists, I mean, if you're doing a study on genetics with the anatomy department, or you're with the biochemistry department, or with pathology or microbiology, they will not necessarily fit into these kind of study design. So we have a more detailed classification for them. So here we have the primary research and secondary research. Primary research, you have basic research, which can be theoretical research, or it can be applied research. So theoretical research can be development of something, or analytical measurement procedures, or imaging procedures, biometric procedures, or test developments. That is, you're developing a questionnaire. This is theoretical, and these are the different study designs in basic research. And then you also have applied research, where you do animal studies, you do cell studies, you do genetic engineering, gene sequencing studies, biochemistry, material development, genetic studies. All these come under applied research. This is basic research. Okay, so when you're writing up your study design, you have more options for basic scientists. And then you have clinical research. In clinical research, you have observational research and experimental research. Experimental research is where you are intervening. You're introducing something, that is drug A or drug B, and then you study which drug works better. So here again, you have, let me tell you at this point that the ICMR specifies very clearly that they do not encourage experimental studies among undergraduate students. That is, for STS research, if it is an experimental study design, it is usually rejected because students are not in that position to conduct experimental studies. They can, it only means that the guide is interested in that, and the guide is using the student to do his studies. So they have clearly stated in the document this time that they do not encourage undergraduate students to do experimental studies. So if ever you're putting an experimental study, you make sure that you change it to a non-experimental study. Okay, then you have observational studies. So you can just have this. I will share these slides with Dr. Sanat, so he can share it with you. So see, when you have to write your study design, you have the different options here, and you can put your study design. Now, next thing what they ask is the study population. Your study population can be a target population. Suppose we are doing a study among teenagers with asthma. So your target population is teenagers with asthma. That is, it takes into consideration the clinical and demographic characters. So you have the demographic character is teenager and the clinical characteristic is asthma. So that is your target population. Accessible population is what is accessible to you as a researcher. So geographically and temporally defined subset. So teenagers with asthma living in the investigator's town in that year. So temporally defines the time, geographically is where you are situated. So this is your accessible population. Your target population is teenagers with asthma, but the accessible population for you as a researcher is teenagers with asthma living in the investigator's town this year. And the intended study population is the subset of the accessible population that you can reach out to. Okay. And the actual study population is the people who actually participate in study. So your study population may be very large, but your accessible population gets reduced a little. Your intended study population gets further reduced, and the actual study population is the group of people who actually participate in your study. You have to state very clearly your inclusion and exclusion criteria. So in your inclusion criteria, you would include the demographic characteristics. Now, suppose I want to conduct a study on women 50 to 59 years of age. 1 second. Okay. Look at the title of the study. We want to see the effect of testosterone to enhance libido in menopause. So in this, the inclusion criteria would be women 50 to 59 years of age. The clinical characteristic is she should be in good general health, has a husband, is concerned about decreased libido. And then geographical characteristics are patients attending the investigator's hospital, and temporal is from Jan to December in the given year. So these are your inclusion criteria. Whenever you're writing about your study subjects, you should specify your inclusion criteria. We want to specify here that while you're using your inclusion criteria, make sure that you take people more than 18 years of age who can participate into your study. Otherwise, you have to take parental consent. The person is not able to consent to participate if the person is less than 18 years old. So that can be a inclusion criteria for most studies. Exclusion criteria in this particular study is high likelihood of loss to follow-up, like alcoholic women and people who want to move out of town. People who are disoriented and have language barrier, they are unable to provide data. So this becomes an exclusion criteria. And high-risk people, that is history of myocardial infarction, where you may not be able to give testosterone there. Low-dose testosterone you may not be able to give. So that becomes your exclusion criteria. So you should be very clear about what your inclusion criteria is and what your exclusion criteria is. That is, you're going on reducing your subjects as to you're going to only include these kind of subjects, and whoever has these characteristics will be excluded from your study. That's about your study population. That is right from your target population to your accessible population to your actual study participants. And now we go to sample size and how you go about with selecting your study participants. Remember, for sample size estimation, just consult your statistician. You have to know the objective of the study. You have to know what is the statistical analysis you're doing. And then the biostatistician will ask you for some reference documents. You give that to him, he will calculate the sample size for you. It is beyond the scope of an undergraduate student, especially a year 1 and year 2 student, to understand sample size estimation. So consult your biostatistician on that. And sampling methods, you have probability and non-probability sampling methods. Probability sampling methods are always better because you are allowing every participant to get a chance into entering your study. So probability sampling methods are better than your non-probability sampling methods. But most of the time you will see that undergraduate research, you have convenient sampling or you have consecutive sampling, which is okay if you're not able to do probability sampling, because for probability sampling methods, you need all the people in that population. Suppose you want to conduct a study among medical students, you have to have all the students there to do a probability sampling method. So Again, you can use the help of a biostatistician, and your guide will also help you with that. Now, interventions, let us not look at it much because they don't want us to do interventional studies. Interventional studies, if you're doing a health education intervention, yes, but if you're doing a drug intervention, it is totally not recommended for undergraduate research. So we'll leave it at that. Data collection procedures. How do you collect data? And what are the instruments that you use? So for data collection procedures, you will see that, let me not get into this. So what is the phenomena of interest you're seeing? What are the variables and what are the actual measurements? It is beyond the scope of a first year and second year medical student. So let me get into your measurement. So what are you measuring, or what is your phenomena of interest? Are you measuring blood pressure? In which case, what are you using to measure blood pressure? You're using a sphygmomanometer, or what is it that you're using? So you have to make sure that whatever measurement that you're using, it should be precise and it should be accurate. Precise is, if you do it repeatedly, you should be able to get it. Accurate is, when you compare to a gold standard, it should be accurate enough. So while deciding your measurement scale, you have to make sure that you are free of random error or free of systematic error. Let me explain it to you in simple words. Like random error is, say you take blood pressure. Blood pressure can vary from person to person, or in the same person, it can vary from morning to evening, or when he climbs a flight of stairs, it can increase. So there is this variation in the person. And every time a doctor is measuring the blood pressure, there may be a slight variation. Not every time it is 120 by 80. It may be 122, 78, or it may be 120, 80, or so on. So these kind of small errors that are there, we call this as a random error. So for you to free yourself from random error, to have your precise measurement, what you do is you take 3 measurements of that person and you take an average of those 3 measurements. So that makes it precise enough. Okay. What is systematic error in blood pressure monitoring then? Suppose your machine itself is defective. It is showing 10 points high. Or the person is not able to hear. His hearing is not good. So that becomes a systematic error. So you have to actually take good care about what kind of instrument you're using. You have to change the instrument in that case. So that is what you mean by free of random error and free of systematic error. What is systematic error and what is random error you have? So what are the different data collection methods that you have? First, you have to know what is the data to be collected. How will you collect this information? What type of instruments are you going to use to collect this information? That is, say you want to do a study on depression among medical students. So how are you going to collect this information? Maybe you will make a questionnaire, which can be used online or offline. You may use, your Google Forms you can use for an online questionnaire, or you can make a questionnaire and hand it over to people. The questionnaire can be self-administered, that the person is administering himself, or it can be interviewer administered. You go out there and collect that data. And you may have some tests and measurements also there. So you may want to see whether it is associated, depression is associated to the body mass index. So you may collect the height, weight of the subject. Again, when you're collecting the height, weight, you should describe this very clearly in your methodology as to how you are collecting the height, how you're making the person stand in the Frankfurt plane and measuring the height, or what kind of machine are you going to use for the weight measurement. So data collection methods has to do with your questionnaire as well as your other tests that you are doing on the subject. Okay. So the type of instrument or tool used, any type of research, be it a research by a basic scientist or a person who is doing research in the field or a clinician, you have to have your tool for data collection or your instrument for data collection. which can be a data abstraction form, or it can be a structured observation guide, or it can be a questionnaire. And your questionnaire should be a valid questionnaire. That is, it should test what it is supposed to test. Suppose you use the Beck's inventory to, that is a standardized questionnaire to measure depression. So it should measure depression and not something else. So it should be a valid instrument that it measures what it is supposed to measure. It should be reliable, that how many ever times you use it, it should be giving the same kind of results. It should be sensitive and specific, and it should be appropriate, and it should be very objective. So this is about your tool for data collection or questionnaire. Always remember to pilot test your questionnaire. That is, suppose you're going to study among 200 participants. So before you give it to the 200 participants, you will conduct a small pilot test on maybe 10 subjects to see whether they are understanding your questions, whether they are, how long it takes to answer this questionnaire. Are there any words that are not understandable? So those 10 participants will tell you what are the problems in your questionnaire, and then you can rectify it, and only then give it to your 200 participants. If a translation is required, then you have to do the translation of your questionnaire in the local language. If you are not using a standardized instrument, we have a whole lot of standardized instruments. That is, other researchers, senior researchers have made these questionnaires. You can use those questionnaires with their permission. But if you're not using a standardized instrument, then you have to validate the questionnaire with subject experts. Suppose you have made some questions, you have referred to many questionnaires and you have made your own questionnaire. Then you have to give it to some subject experts to validate whether the questionnaire is assessing what it is supposed to assess. Suppose you are doing procedures, in which case you have to undergo a training and have a certificate from the department that you are trained enough to go and do this in the field. Only then you are allowed to go and do these procedures during your data collection. Quality control, ICMR wants a note on quality control. Quality control is whether you are following all the steps correctly, whether you have enrolled your participants properly, and whether you are collecting your data properly. You can see a whole list. Whether the design is supported by preclinical, animal, or other appropriate data. The study is conducted according to ethical research principles. The written protocol is carefully followed during the study. Investigators and those providing clinical care are trained and qualified. All clinical and laboratory procedures meet the quality standard. Data are reliable and accurate. Their complete and accurate records are maintained. Then whether the proper statistical methods have been used, and whether the results are clearly and fairly reported. So you have something known as good clinical practice guidelines. So whether your research is adhering to the GCP guidelines. So that is quality assurance. They want you to add a note on the quality assurance. How are you ensuring quality assurance? Let me give you an example. Suppose you are going to do spirometry on a group of people. Suppose you want to study COPD and you are doing spirometry. Whether you have the standard operating procedures, whether you have a small booklet to say how you will go about, how will you ask the person to blow into the spirometer, and how are you going to take those recordings? It should be very clear out there. They want you to add a note on confidentiality. Confidentiality is about the data, okay? You can see if there is any breach in confidentiality, it might cause stigma or discrimination, especially when you're doing very sensitive research topics like sexual attitudes or practices, or use of illicit drugs, or illegal conduct, or psychiatric illnesses. Here, you don't want people to know who these people are. So you don't have to name the participants. You are not going to, you're going to code your data, and you're going to protect the identity of the people. Okay, so confidentiality is very important. And then how do you plan your data analysis? So you have to, again, here take the help of your guide and your biostatistician in your college. How you are going to enter the data, what software are you going to use, and what are the descriptive statistics that you are going to use, that is whether incidence, prevalence, or tables, graphs, how are you going to depict your data? And then what kind of inferential statistics, that is which tests of significance are you going to use? All this should be very clearly specified in your protocol. So let us look at it one by one. You are going to say what is the type of study and the study design. Okay, whether it's a cross-sectional survey, whether it's a cohort study, whether it is a descriptive study, whether it's a, experimental, of course, is not allowed here. So whether it's a case series, so you're going to talk about what type of study it is. Then study population, you're going to exactly say who are your study subjects, geographically who is accessible to you, and what is your inclusion criteria and what is your exclusion criteria. And then you're going to talk about the sample size. Your biostatistician will calculate the sample size for you. And then if you have an intervention, you have to write about it. And then what are your data collection procedures, or what are your instruments used? What is your questionnaire? Have you done the pilot test on the questionnaire? Have you validated your questionnaire? And if you're using any devices, any instruments, like what are those? And have you received training in that? And are they SOPs, standard operating procedures manuals on that? Then you write about your quality control, whether you're following the GCP guidelines. And then you talk about confidentiality of the data, which should be specified clearly. And then you plan the analysis, where you are going to write what software were used, how you entered the data, how was the coding done, how was the analysis done, what was the descriptive analysis, what is the what were the statistical tests done, what was the inferential statistics. You're going to talk about that in your analysis. Then finally, your ethical considerations. Ethical considerations, you talk about confidentiality of the data, anonymity of the person, patient autonomy. Autonomy is the patient should be free to leave the study at any given point of time. So that is your patient autonomy, and he should sign the consent form to participate in the study. And then you take care of patient safety. You have to take the signature of the patient on the consent form. And if it is a child, the child has to assent, and then the parent has to consent. Then when any study that is done, it should benefit the patient. Non-maleficences, it should not harm the patient. And it should not, ignore some class of people. So there should be social justice in there. And then it should have the ethics committee approval before you go ahead with your study. And these are taken as specified by ICMR. What are the implications or the outcomes of your study? This should describe what is expected to be achieved or gained from the proposed research in terms of scientific advancement. It can also include the skills and knowledge gained by the student. It should be a useful study. And in what way is it useful? References, you have to use the Vancouver system of referencing. Vancouver system of referencing, you can go online and see how it has to be done. There's a specific way in which it is done. If I am Rizwana Burhanuddin Shaikh, then I become Shaikh Arbi. So there's a way in which you write the names. There's a way in which you write what has to come first, the names, then the topic, then the journal, and then the year, and then which year of publication, and which volume, which edition, and which page number. It has a way in which it goes. So there are enough number of documents on Vancouver system of referencing, so you can refer that and write the references accordingly. So just don't have your research rejected because you did not follow the Vancouver system of referencing. It could get rejected because you were so careless that you did not use this method, although it has been specified. So make sure all these finer details are looked at while you are submitting. Now coming to the final thing, that is what is required of you during this submission. First is you have to, you have the AF format for STS 2024. This has all the details of the student, the guide, and from which place, and your phone numbers and your email IDs. All these details are in this AAF format. So make sure that you write that and get the signature of the HOD and the head of the institute, a dean or principal. So this is the AAF format first. Then make sure you get your ethics committee approval. Ethics committee approval has been made mandatory this time. Just in case that you don't get your ethics committee approval, then you have an undertaking from the guide that it will be submitted. So in your HRD guidelines on page 28, they have mentioned this, that you can take an undertaking from the guide that it will be submitted on a later date. Then you have to make your informed consent, and that should be an annexure. Then case study form is not necessary. It's not very important. Your draft questionnaire of your study is required, and any other supporting document you have to attach. Okay, so you have your protocol. Keep all these things ready when you are submitting your AAF format, your ethics committee approval. If you don't have that, then an undertaking from the guide, then your informed consent form, your study questionnaire, and any other supporting documents. That is, if you have taken permissions from the colleges where you are studying, or if you have any such supporting document, you have to attach that and put up the annexures. There's a very nice, YouTube video that tells you exactly how to go about with, submitting your proposal. So go through that. It's a very useful link, on Eco platform. It's available on YouTube. It gives you step by step as to how to upload your document. And then finally, all the best for your project. I hope your project gets selected. If there are any questions or queries, you can start asking now.
Yes, I have a question. Can I go through?
Yeah.
Okay, thank you. So on the first slides, I saw something like like this will be for the medical Indian students. So I'm wondering like if you're a foreign student, like maybe you are from Africa or you are from the USA, can you participate into this same STS?
I'm sorry, you have to be a student of an Indian medical college or Indian medical university. It's not open for, suppose you are an NRI, a non-resident Indian, or a foreigner, but you are studying in an Indian university, then you can apply. If you're not studying in an Indian university, you can, Indian medical college.
Okay. No, thank you.
Any other questions?
Hello.
Hello, yes.
I wanted to ask about the word limit. Like the methodology, it says 800 words. So
Yeah.
is it like we have to write 8 pages, 100 words is equals to 1 page, or like we have to count individual words, or what is that? I cannot understand.
You have that option on MS Word. If you just highlight, it will tell you how many words. Approximately, I must say, one page has 300 words, 300 to 350 words. One
Alright.
page.
So like we have to count like individual words, right?
Yes, you have to count individually.
Thank you.
You can use MS Word for that.
Thank you.
Try not to exceed the
Hi, hello
word.
मैम.
Hello.
हेलो मैम. एक्चुअली मतलब जो क्वेश्चनरीज वगैरह हमें सबमिट करनी है एट द टाइम ऑफ डॉक्यूमेंट सबमिशन कर सकते हैं, या फिर अगर हमें कुछ हमारे स्टडी में फ्यूचर में अगर कुछ डिफरेंट क्वेश्चनरीज कुछ इम्प्रूव करना है तो सो वी कैन डू दैट.
Come again, please.
हाँ मैम, मतलब जो हमें क्वेश्चनरीज वगैरह यूज करनी है हमारे स्टडीज में, वो एग्जैक्ट क्वेश्चनरीज अभी हमें सबमिट करनी है, या वी कैन improve that questionnaire later during our study time?
Yes, yes. What you have to do now is submit your draft questionnaire. Your draft questionnaire is the most likely questionnaire that you're going to use. You will improve upon that. You can improve upon. It's not like once you have submitted,
And
I cannot add any questions, nothing like that. You are just submitting your draft.
And we have to which is better, we have to create our own questionnaire, or we have to use another one that is the standard questionnaire from foreign or from Indian researcher?
See, there are some standardized questionnaires. Suppose you want to, study stress, or you want to study depression. There
Yeah.
are good standardized questionnaires available, but you have to, get in touch with the researcher there who made that questionnaire and take his permission, and only then use. So while you're attaching your annexures, you have to attach that letter that this researcher has given you permission to use that questionnaire. Okay. So otherwise, what you can do is you refer to different questionnaires and you develop your own questionnaire. Once you develop your own questionnaire, since you are a first year, second year medical student, you have to get it validated by some senior researchers. You have a panel of senior researchers who have worked in the same area, and you ask them to validate your question. There is a way to go about it.
We cannot use a standard questionnaire directly by citing by using the citations.
There are some questionnaires that are free to use. The questionnaires that WHO puts out or UNICEF puts out, there are some free to use questionnaires. And there are some questionnaires that they charge you for the questionnaire. Suppose you want to do self-directed learning among medical students. SDLRS questionnaire is there. They charge you for that. And if it is a junior researcher, if it's a medical student, usually they waive away. They just allow you to use. Once they know you're a first year, second year medical student, they allow you to use. They don't ask you to pay. But what is important is that you have asked for that permission to use. That permission letter should be there. They say, yeah, we won't charge you, use the questionnaire. But they only tell that you have to cite us while you are using it. You have to make sure that you write that the standardized questionnaire by Beck was used.
Yeah, means we have to their permission
I have
form.
a question.
Yes, yes, you have to. Yes, yes.
Okay, thank you so much.
Ma'am, I have a question.
Yeah,
Very
tell
good
me.
evening. Ma'am, ma'am, I have two questions, ma'am. The first question is how we select the correct research problem, ma'am? Because the statement of the problem is we go and refer for the any Googles or references. It comes a same sequence. Okay, for example, the hypertension and diabetes mellitus, it is coming a repetitive the sequences, because we go in the community, we have so many issues are there, but how we selected for the student period, if for that the different levels of the problem.
You have to decide which is your area of interest. Suppose you go out in the field and you see that you are more interested in malnourished children. Okay. So in which case, then you go and contact a guide who is working in that field. And then you see what about malnutrition you want to study. Whether you want to study what are the causes of malnutrition, whether you want to study, suppose you're taking a toddler, as you say, you want to study how was the birth weight of the baby, and there's so many factors. As I told you, you have to brainstorm. So what is it that you want to study in this toddler? What is it that you want to study? Whether you want to study the growth, or whether you want to study about any health condition, you have to reach that. You have to, if you're not able to reach that, you have your guide, you go and talk to your guide and say, I'm not able to focus on any particular thing. So then your guide will give you a direction that maybe, yeah, you talk about, malnutrition and the economic impact, like, how the family is doing, whether the buying capacity or the purchasing capacity of the parents or working parents. They may give you different ideas what you have to focus on. And also it's your own interest also. So I had one particular student of mine who wanted to study health financing, like out-of-pocket expenditure among migrant, people. Like, so in Bangalore, we had a lot of migrants who had come to work in the, Bangalore is expanding. So in the labor field, you have a lot of migrants that have come in. She wanted to know that if these migrants, they don't have their Aadhaar cards or anything here, they are from another state. So, but I want to know, how are they financing their healthcare? If they have a sickness, if they have to go for hemodialysis or something like that, how are they financing it? So that was a very interesting question. So her research became healthcare financing among migrants in Bangalore. So she asked about how are they doing it? Like, is it out of pocket? Is it catastrophic financing? Are they selling anything? Or are they, not seeking healthcare because they're not able to finance them? It came out to be a very interesting research paper. So it really depends on what you are seeing. Be very alert to what's going on around you and what is it that you want to study.
Madam, I have a
Thank
question.
you, ma'am.
Yes.
Another question I have.
Yeah. Can we finish with the previous one?
Yeah.
Sir,
I'm asking about uploading of whatever this one candidate registration, as well as uploading the documents. What exactly is the uploading website, ma'am? Can you give me the link to that so that we'll be able to easily upload onto ICMR website?
I have shared a YouTube video, which gives you step by step how you have to upload. What is the website? What is the link? Everything. I will ask Dr. Sanath to share all the documents that you require. I have made a set of documents that you have to have, and what is the link and everything. So, Dr. Sanath, are you here with us?
Yes, ma'am.
Is there a way in which you can reach out to everybody regarding this?
Yes, ma'am.
Yeah. Can you share all the links with everybody?
Yes, ma'am. We'll be sharing the PPT as well as the link to this recording in our WhatsApp group or activity group.
Plus, I need to add some extra, all the documents that are required.
Sure.
So, AF form and everything, so that you can share it with everybody.
Thank
Sure,
you. Thank you.
That was Dr. Murthy sir, ma'am, from Professor and HOD Psychiatry from Santiram Medical College. We welcome you to this webinar as well, sir. Thank you.
Thank you, ma'am. Thank you, sir.
Thanks.
Okay, any more questions?
I can see
ma'am,
some
I
messages.
have another question.
Can third year medical student do ICMR STS? No. What's the last date for submission of proposal? June 30th. Someone has answered. Sanath has answered that already. I'm including toddlers. Who is your guide? I'm sure there must be a pediatrician or there must be a person from community medicine must be your guide. You can, see how you can go about that. You have to clarify that with your guide. Is study questionnaire compulsory for any kind of research? Yeah. It may not be a questionnaire. Not all studies are with questionnaire, but you have to have a data extraction tool. Suppose you're doing a study, a record-based study, and in that record-based study, you want to see, you have chosen so many variables. So in that case, you have to have a data extraction form as to what is the detail. Maybe you want the age of the participant, maybe you need the gender of the participant, and you want to know the blood sugar levels, or, there are so many parameters you would want to know. Suppose a record-based study of the, mucormycosis patients, during COVID time. Suppose that is your study. From the records, you want to know the mucormycosis, what were the various factors, why they ended up with mucormycosis. So in that, such a study also, you need to have a data abstraction form where you have these patients and you want to see what were the risk factors in those people, whether they took the vaccine or not, how old they were, whether they were diabetic, whether they were given steroids. So these things you have to have a data abstraction form. You will not have a questionnaire there, but you will definitely have a data abstraction. Yes, in that case, everybody should have a clear idea as to how they are going to document or how they are going to collect the data. Please share the YouTube video link. Yes, Dr. Sanat will do that. Can you please tell the format for undertaking form in case I'm unable to submit IEC approval? Yeah. There is one format that is available in our college. Maybe I can share that also. Okay, that the guide has to give that undertaking. Yeah, we can share that. Not today, maybe, because it's in my office. I can share it. The website is crashing. Yeah, maybe you just have to have a good connectivity. Make sure that your internet is strong, and it should be. There is like, sometimes it just doesn't open. So initially I could not open it. So you have to make sure, take the help of the IT person there. He will show you how to, it's to do with the cookies and, your firewall or whatever you use. That's the one that's stopping it. So you just have to remove that and then you can start accessing. So Nabila, I think it's to do with, you have to reset your laptop with the help of an IT expert so that you can view things. And Sanat has already told, try using a different browser. Yes, even that helps. Use either Firefox or something else, then it opens. Are there any specific words while we are writing a topic? Yeah, it should be in line with your objectives. Definitely, it should be in line with your objectives. Whatever objectives you have to. Then you can make fancier titles also. Who are eligible to apply? It's Fatima. We have already told that. What are the research opportunity for a third year MBBS student? I can see a teardrop there. Sehla, Canada. Okay, third year medical, you have a lot of intramural grants that are available from the university itself, whichever university you are. Like suppose you are in RGHS, you have the intramural grants there. All the private universities have the intramural grants that they give to their students. So you apply for the intramural grants, and then you have a whole lot of other grants that are available out there. You just have to search. Maybe we can have a session on the different kinds of grants available for undergraduate students. There are a whole lot of them.
I think we can have a couple of questions more, and we're running short of time actually. So, yeah. Any more questions? Two more. We can have two more questions.
Yeah. If there are not any more questions, then I think we can.
Is my guide supposed to be from the same department, which is like the concerned department for my study? And also, like the last question that I asked regarding the word limit, you were adding something up, but then someone interrupted. So if you could complete that.
The word limit, you have to adhere to the word limit. Otherwise, your protocol will be rejected at the word counting itself. It is not one researcher who is looking at that. It is a clerk who is looking at that. And it has a chance of getting rejected at that point itself. So word limit is you just, when you open your Word file, you highlight what you have written. Below it will give you the word count. That is very easy to see. So are you getting me? You just open your Word, whatever you have typed out, just highlight that. It will tell you how many words it has.
Yes, ma'am. And regarding the guide?
The guide should be from your college.
Is
not
he or
any
she
specific department or no. Guide can be from any department, but the guide should be from your college. Preferably, if you're doing something related with psychiatry, then we hope that you have a psychiatrist. But any other person, maybe a person from community medicine who's interested, can be your guide on that particular topic. So it's not that the person has to be from that department. Preferably, yes. Preferably, yes.
Thank you.
Thank you,
Hello,
guys. Hello. Okay,
ma'am.
one
Last question.
one
Yeah.
last.
Ma'am, am I right to say that a second year student can participate in research and do it in summer vacation of third year and fourth year, but third year student can't participate in at all?
No, not at all. I don't know why
But
that's very unfortunate, because we have a batch of third year students who had exams when the first STS was announced. So they could not participate, and now they are not eligible to participate. So that's very sad for them.
means that eligibility is only for to participate. Rule is to only participate. We can do in third year and fourth year. That's okay.
But not with ICMR.
Means ICMR you should complete before third year.
Before third year, yeah, before third year.
Okay, you should complete research before third year. Okay.
No, no, no. See, only first years and second years can participate, and they have 3 years to. They have 2 months settings to finish it off. So third year is
Yeah,
not.
means that research can they do in third year, fourth year also. Means space to
Yeah, it can
part.
extend. They are in second year now. It goes to third
Yeah.
year. And yeah, it can go.
Means I mean right now in the second year, so I can apply now and I
Yes.
can do it in my
Yes.
third year, fourth year vacation.
Yes, of course. Yes, of course.
Oh,
There is one question, madam. Can there be a single guide or more than one for more than? No, no, no. You can't be a guide for more than one student. One guide, one student. And you cannot change the student from the research, but the guide can be changed. Like if suppose the student has started research with one guide, and in the middle of the research, the guide got another job and took a transfer and went. So in which case, the guide can be changed. Whoever's available then will, the previous guide will assign a new guide and will go. But student cannot be changed. The guide is there, but the student has gone. So in that case, you cannot conduct the research.
Ma'am, one more doubt. Ma'am, am I audible?
Yes, yes, you are, Shrikant.
Ma'am, we have in the publication, free publications are available for the undergraduate students, ma'am. Because in undergraduate level, we have we completed the entire project we submitted, and after that it is a project. After that we are not it is not go for the any indexed journals or Scopus journal. It not reached them for the entire world. So any free publications are available. How it apply, ma'am?
There are journals for undergraduate. Nowadays, other journals have a slot reserved for student studies. So a lot of journals are taking undergraduate research. There are some journals that are only for undergraduate students also. So you don't have to lose heart that, and also you have the guide that. Some of the publications clearly ask that the guide has to be there. So the guide has to be the first author, and then. But now publications are open for undergraduates to publish. In fact, we can give you a list of journals that take undergraduate publications also.
Okay, ma'am.
You can be the first author. You can be the first author. As long as you write your guide's name. Your guide's name is there in the authorship. Even if it is the last author, the guide's name should be there in the authorship.
Okay, ma'am. Thank you, ma'am.
So thank you, guys. Now I will not be taking any more questions. Now I hand over to Rakshit for a vote of thanks.
No, there is one question here on angiography and branching pattern of ACA. What will be the type of research. This is a descriptive research only because you are not doing anything. You are not doing any intervention here. So it will be a descriptive study.
Thank you, ma'am. Rakshit, I hand it over to you for a vote of thanks.
First and foremost, I would like to extend our heartfelt gratitude for our esteemed speaker, Mr. Rizwana B. Ma'am, for sharing your profound knowledge and expertise on topic, which is approach to ICMR. Ma'am, your delighted insights and practical guidance have not only enriched our understanding, but also have inspired many of us to pursue the research with renewed vigor and clarity. Ma'am, your contributions today have provided a roadmap that will surely benefit countless aspiring researchers, ma'am. I would also like to thank our organizing committee for their dedicated efforts in putting together this event. Your seamless coordination and meticulous planning have ensured that everything ran smoothly and that we are able to maximize our learning experience. And a special thanks to our technical team for managing the digital platform so efficiently, ensuring that we could all connect and engage without any hitches. To all participants for your presence and active engagement, I made this webinar a successful webinar. Your questions and interactions have added a great value to the session, making it a dynamic and enriching experience for everyone involved. Thank you once again, ma'am. And thank you for being a part of this wonderful session. We would look forward for more such opportunities to learn and to grow together, ma'am. Assistant State Director, ASO GAIMS Karnataka, ma'am. I would like to hand over to Sonal.
Thank you, Rakshit, for the vote of thanks. And adding to this, one personal mistake that I don't want all the participants to commit is you must have a checkbook, a blank check in your name. This delayed our submission, and unfortunately we couldn't submit it on time. So post submitting your abstract, make sure that you have a checkbook in your name with I think you'll be needed to submit a blank check of yours for the ICMR to give their stipend. So that's it. Firstly, ma'am, Dr. Rizwana, ma'am, thank you so much. It was indeed a very insightful. Managing to cover such a huge topic in under 1 hour was a very difficult task, but you made sure that you covered almost every aspect. And I'd also like to take this opportunity to thank our national team of GMs, that is Dr. Shubham Anand sir, who's our founder and national chairman, and our national president, Dr. Abhinav Jha sir, as well as our National General Secretary, Dr. Saurav Kumar Das sir. I would also like to thank the national team of IFMS, Mr. Cyrus Datta sir, and our joint secretaries, Aditya Rao, Mr. Aditya Rao, Ms. Harshin, and Ms. Priyansha Chawla. And last but not the least, I'd like to thank Dr. Aslam sir, who's our president, GAIMS Karnataka chapter, and the IT team. At the last event Raso Karnataka conducted, unfortunately we couldn't record the meeting, but Dr. Aslam sir and the IT team have made sure that we have a recorded version of this meeting, which shall be posted on YouTube, and the link will be shared in the activity group as well. I'd also like everyone to fill the feedback form, which is now sent in your chat box. And lastly, Dr. Rizwana ma'am, I thank you again for making this happen, and we definitely hope to be part of more research workshops like this that will be conducted by you. Thank you, everyone. Now I request everyone to switch on their camera so that we can we can have a group snap. Kindly switch on your cameras, everyone. We will have a snap, and also fill in the feedback form that is presented in the chat box. Thank you, everyone. Thank you for your valuable time. I hope you've gained a lot out of this. And Rizwana ma'am, thank you once again. Thank you, guys. And personally, I was very happy to see more than 400 registrations, and the enthusiasm that this enthusiasm everybody is showing towards research means a lot. I know we are very much, we have great potentials and we lack a good platform. But I hope Rasog as well as James will be able to provide more workshops like this that will be helpful to all. Thank you one and all. Thank you for your valuable time. Thank you so much. I think we can exit now. Thank you.